Hey everyone, this is Victor from Cyborg for Life, and today I have a very special interview for you. I am joined by a cosmetic limb lengthening patient who, after years of recovery, discovered that he was dealing with a serious complication, which was chronic osteomyelitis, or if you don't know what that is, it's persistent bone infection caused by infected surgical hardware. And today he's here to speak about his unfortunate experience due to this avoidable complication. So I would like to welcome V to the show. Hey V, how are you doing today?
I'm doing good. How are you?
Thanks so much for joining me. I'm doing well. So V, I just want to kind of like get right
Yeah.
to it. Why did you want to get the surgery done? Talk about like your starting height and then like what your goals were with limb lengthening. And then we're going to talk about like your experience and like the complication you faced.
I 2020 did some research and I found your channel. And my height at the beginning is around, it was around 170, 171, something like that. And my goals at that time, I tried to reach around like 8 centimeter or 9 centimeter. And actually, I reached the goal.
And so you did this. What device did you have to lengthen your femurs?
I did the LON.
LON. Okay. So for those of you who are watching and don't know, the LON stands for lengthening over nail.
Yeah.
It's basically an external fixator with an internal trauma nail that goes in and holds the bone in place. What did you achieve in terms of your lengthening?
I think I achieved 9 centimeter.
And how long after were you able to walk?
So the process took me around like 3 months, and then after that, I can use crutches to move around, and then I stopped using crutches like around 6-7 months after remove the fixator. Yeah.
How long after that did you first notice that something wasn't right? What were the symptoms that you were experiencing?
Going back to February 2022. So after come back from Turkey, because I did with in Turkey, I feel very painful after came back to the US, and I called them and I talked to them. I think I also emailed you about my situation. Asked me to do some X-ray to show them how my bone looked like, and they told me to go to nearest hospital for the X-ray and send it to them. And the X-ray saw something very concerning. A screw near my hip at the top part of the rod were loose. It's clearly visible. And the local doctor who saw the X-ray told me you really need to contact the original team. And I sent the X-ray to them, and they asked me to come back to Turkey immediately, and I booked the ticket to come back to Turkey for the second surgery. By this point, I was almost sure I had an infection, because then the way the screws was loose and when everything already done, but I don't, that's the feeling at that time. They performed another surgery. They replayed, and I stayed in Turkey for 2 weeks after the procedure. Came the antibiotic treatment. It lasts for 6 weeks. And they mentioned my white blood cell count were finally started to go down, and they also did the MRI and other X-ray before I left to come back to US. And after all the tests, they told me no infection, blah, 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 and then gave me peace of mind, at least for a while. Until late 2020, after returning to the US, everything seemed to improve. I feel strong, healthy, and finally move forward. And around like October 2022, I found a highly skilled orthopedic surgeon with experience in limb lengthening method. And I scheduled a consultation, talked to him, and after reviewing my X-ray, he told me that my bone row looked really good. And I asked him when can I get the rod removed, and his answer surprised me. So unlike Dr. who says the rod could be removed after 1 or 2 years, Dr. A were much more conservative. He told me like it's the best to wait at least 2 to 3 years, monitor everything carefully, and only then consider rod removal. Around more than a year later, right, around February 2024, I started to experiment the pain again, this time near the bottom of the femur, close to the knee area, where the fixator where the nail or the fixator around that area. And he ordered x-ray. He found the screw at the bottom of the rod had come loose again. Yeah. And it was no longer fit into my bone. And he was puzzled. He said, this is really strange because it's almost 2 years. The screw had been there for a long time. Why it's coming loose now? So to be said, he decided to go another surgery, remove the screw, and run the test to rule the culture, you know. And during the operation, he also collected a bone sample, test for an infection. And just about 2 weeks later, so around March 2024, I went in for a follow-up, and that's when I received the diagnostic bone infection. Yeah.
So you got this checked out. There was the distal screw of the nail.
Yeah.
It was giving you some trouble. It
Yeah.
came loose.
Yep.
The doctor was looking at it and he said, look, let me investigate this a little bit more.
Mm-hmm.
And he basically figured out that you had a bone infection.
Yes.
And when you heard this, that's a pretty serious diagnosis, especially, you know, you went through this whole limb lengthening process.
Yeah.
Were you a bit worried? How did you feel mentally about hearing this diagnosis?
I really worries about that. Yeah, because, you know, bone infection is not something like easy to treat, you know. And the worst case, they're gonna chop your leg. You know what I mean? The worst case, they're gonna chop your leg. So, no one wanna that happens.
What exactly was his plan?
So I talked to him, and his plan were he gonna inject the antibiotic. He gonna clean it. He explained me very carefully, and his team include radiologists and infectious disease doctor and my orthopedic. I talked to all three of them. And so they finally come up with this solution. Decided to take the drop out, clean the bone inside the bone, and then they put the antibiotic inside my bone. Yeah, and I had to go through around 6 weeks for antibiotic through my vein with the IV, and it's terrible. It's terrible.
Was there a point where things started to look better and started to clear up the infection?
Yeah, so it took around like 3 weeks because, you know, I had doing antibiotic through my vein very tough, you know. You cannot take shower, you cannot do anything. And then they also collect my blood test every week also. They monitor it.
So they monitored it for every week. And was there a point where Dr. M was confident that it would clear the infection completely with this antibiotic?
Yeah, the doctor, he very confident about that because I asked him very clearly, I discussed with all of them, like, this can be treated. And they said to me, yes, but they must be aggressive to it.
Got it. So
Yeah.
you seem to have caught this infection just in time, right?
Yeah, exactly.
If you would have caught it earlier, it would have been better. But if you caught it any later, it could have been worse.
Exactly.
Right?
Exactly.
So what were the signs and symptoms that you felt? You felt pain, or what did you feel exactly?
So at the beginning, early stage, I just feel like there's something sore around the screw area. You know, and it's hurt me when I walking. So I just went to see him and check the X-ray, and we saw the screw was loose. So the pain at the beginning, it's just like because the screw is loose, so that's why it bothered me when I'm moving around. You know.
Got it. So
Yeah.
really, it was the distal screw
Exactly.
being loose and giving you pain and irritation that really led you to go look in deeper.
Exactly.
I see.
Exactly.
So
Yeah.
you got the infection cleared up.
Yeah.
It started to go away. Did your bones in that area start to heal after this?
Yes, it's healing. It's healing very, very well. And to be honest, my left leg is very good. Nothing nothing.
Summarize this. Basically, you got surgery done in 2021. What month was this?
November 2021. I finished like February 2022. Yeah, and then they removed the fixator at the same time.
So they removed the fixator February 2022.
Yes.
You started to really walk a few months later after.
Yeah.
It was like a couple months later that you noticed that you had that pain in the upper screw and the lower screw?
The upper one is just like 3 weeks later after the fixator removal.
Okay. So
Yeah.
got it. All
And
right.
the lower screw, it just around February 2024, just last year.
So almost 2 years after
Exactly.
you
Exactly.
were finished lengthening.
Exactly.
Wow. So it
Yes.
took some time for this infection to kind of catch up. All right.
Exactly. Yeah.
And what exactly did Dr. say that led to this bone infection, this osteomyelitis?
I talked to him, and then he asked me about the past procedure that I did in Turkey, and he said to me he come up with conclusion because this LON method, yeah, it's not like the safest way to make you taller. You know what I mean, right?
So he said
Yeah.
that it's this method that you did that
Yes.
could lead to this bone infection.
Yes.
So
Yes.
he was a little bit against the LON method for lengthening.
He not say he again it or not, but he says to me like because it's open wound, so obviously you have very high chance to get the infection.
I see.
Yeah, yeah, you
So
know what I mean.
because of the open wound,
Yes,
meaning like your body is open to the outside
exactly,
world, bacteria
exactly.
can get in.
And since he does say like this not good about he did because he did not did the procedure, so he doesn't want to comment about that.
I
Yeah.
talk to a lot of patients who have similar
Yes.
complications, and you're finally coming forth to speak about this is huge. But
Yeah.
for other limb lengthening patients, what would you say to someone who's dealing with this complication or who is looking to get lengthening with the LON and they are worried about, possible bone infection?
So actually, to be honest, after going through all of this, I don't recommend do the LVAN. I know that, yeah, the Dr. M right now, the one who working with me, he didn't say he again it or not, but based on what I'm talking to him, I feel like he also doesn't like this method. And yeah, if you want to do go through this procedure, just do something better and looking for the better doctor. And I just don't like the way that the people in Turkey,
How
yeah, they
did they,
just
let me ask you about that. How did they
yeah.
handle this? Because they brought you back to Turkey. You bought the ticket, you went back to Turkey,
Yeah.
and because after they saw the imaging, they didn't really find anything. Did they just send you back home? What exactly did they do?
When I came back, I think they gave me some antibiotic to or pain reliever to make me feel better. But after that, they just recommend me, take something antibiotic. But I don't feel like they actually try to fight the bacteria. And I realized after replay the rods, right, they do the MRI because at that time there's no meaning to do that because when you take some antibiotics, it's very difficult for them to figure out what kind of bacteria. You know what I mean, right? Because you already took some antibiotic, and then it's very difficult for them to look through MRI and stuff
Was this oral antibiotics through the mouth or was it IV?
to the mouth, to the
To the
mouth.
mouth. And they basically did the nail exchange. When was that they did that?
The nail exchange is to the second time when I come back to Turkey, just like 2-3 weeks. I removal on February 2022, and then just a month later, 2-3 weeks later, I come back right away
Wow.
because the upper screw.
Okay. So, but at this point, there was some infection building, and they just didn't catch it, and
Exactly, they didn't
they
catch
took
it.
it home. They didn't look into it.
This just terrible experiment.
Yeah.
They just they don't actually like have you figure out what's going on, but they just give you some medicine, okay, to make you don't feel pain. The long term, the bacteria are gonna be building up and they're gonna be developed, and then it's gonna be as war.
It got worse over
Exactly,
the course of the next 2 years. You basically had to go to another surgeon to get this corrected.
exactly.
So you basically don't recommend that patients, who are looking into femur lengthening to do the LON. You
Yeah.
think that it's a little bit too high risk for potential bone
Very,
infection.
yeah, I think so. Because
Right.
to be honest, the people went through this procedure with me in Turkey. Most of them had infection.
Most of them.
Yeah, a lot of them. Yeah,
Wow.
yeah.
Wow.
I know another guy in New York. After around like 1 month removal, he come back to Turkey. But it didn't work out. And then he had to looking for some doctor in New York City.
To be able to
Yeah,
correct
and
that.
then exactly, and then he also had the antibiotic through the vein with the IV.
So he had to do the same thing that you did,
Exactly.
but he had an infection. And how many patients would you say you knew that had this infection? Could you
So
count?
I think 4 or 5 people.
Wow. Yeah. So the femur, higher risk. There's a lot more soft tissue there, a lot
Yeah,
more chance for
yeah,
bacteria.
yeah,
Wow.
yeah,
Well, V, I really appreciate you open up about this. This is not easy to
yeah,
talk about infections, setbacks, fears, but you're doing it to help others, and that says a lot about your character. So
yeah.
I want to know now, how are you recovering and what are the next steps and like what are you looking forward to?
So right now, I feel really good. Yeah, I feel really good. I just tired of surgery.
Going through
Yeah,
this for almost 4 years,
I
3.5
know,
years, you know?
I know, I know.
Wow.
It's just so hopefully nothing happen in the near future. Yeah.
Yeah. So did Dr. M say that when you might get the nails out for good?
So right now on for my right leg, they remove everything. Yeah, because you cannot leave any metal or nail rods inside when doing the treatment. Yeah, they said to me they had to remove. But the left one, everything's still there because it's good. It's still very good. So and they very conservative. I asked them to remove all of both legs, but they say like no, you have to keep one leg strong.
Yeah. Yeah. You gotta keep one leg strong so you can get around if you know.
Exactly. So I feel great right now, but the one important lesson that I learned is never risk your health and always seek out truly, expert, qualified medical professional. And honestly, I wouldn't recommend seriously consider to this procedure. So at one point, I will even activate for my medical bill with Bitcoin, and this was a major red flag and make me very uncomfortable. And I also meet many patients who initially very happy, but later, many of them, like me, develop serious infection, and I deeply regret my decision to do the LON. They also regret about their decision doing with them in Turkey. And the truth is, with this kind of procedure, you really never know what might happen. So you have to looking out the real medical professional and doctor who have expertise in this field.
So you're basically saying that, be cautious, be
Exactly.
aware. Do not just go fall for the flashy marketing because
Exactly.
there
Exactly.
could be complications waiting for you on the other side.
Exactly. Because you
Yeah.
don't know. It's gonna happen, after 3 months after done with the procedure, they remove everything. You feel great. But like me, 1, 2 year later,
Wow. That's
everything
scary.
getting worse. Yes.
That's super scary. Just think about it. It's like you're
Yes.
walking around, you're recovering, you feel like you're
Exactly.
taller, you're living your life, and then all of a sudden you start getting this pain in your legs. And
Exactly.
it may not be in both legs, it might be just
Exactly.
one leg. Then you say that I actually have a bone infection. And now I
Exactly.
gotta pay out of pocket whatever resources I have just to correct this complication.
Yeah. Exactly. And
They ask you to pay
it's
with cryptocurrency,
exactly cryptocurrency.
not
And
even a wire transfer.
exactly. It's so funny. It's make me like,
That's a little bizarre, don't you think?
yeah, really. It's so that's why I mentioned to you. It's a major red flag.
Yeah, yeah. If a clinic that's taking several thousands of dollars is asking for you to pay in cryptocurrency, is there where there's no trace, right?
Exactly.
And yeah, that's a little bizarre. But you also said that there were other patients that you knew, like 4 or 5 of them, that had bone infection as well. And then you said that some of them that were advertising for this clinic in particular no longer wanted to associate with them after they had issues.
Exactly. Yeah, and right now I feel like the right one is the infection, the one got infection. The lane different.
So there's a length difference now.
Exactly.
How much?
I am not sure, but I believe it's around like a couple millimeter.
Wow.
And actually, Dr. M, he measures. He says to me like it's around 3 millimeter, but I feel like it's much larger.
Because you can feel it.
Exactly.
Yeah, because people who walk around with a 5 millimeter difference, they don't even notice it. But if you can feel it,
Yes.
there's something there.
Yes. And actually, some people they notice about that.
Wow, people
Yeah.
in your life.
Yes.
Wow,
So
that's
some of
that's
them.
pretty serious.
Yep. Thank you very much.
Well, this has been incredible. Again, I want to thank you, V, for coming on and
Yeah.
sharing your experience, sharing this unfortunate complication, but you are now on the other side of it.
Yeah.
You're better for it now that you've gotten through it. And I think all patients listening to your story is going to be very thankful to you. So, but
Yeah.
for all those who are listening out there, if you've had surgery and something doesn't feel right, don't brush it off. Get answers.
Exactly.
Ask questions. Seek treatment as soon
Yeah.
as possible. As you can see with V here, there was an infection brewing, and for over 2 years he had a osteomyelitis. Luckily, he caught it in time to salvage his limb, or else there could have been amputation. Right.
Yeah. Yeah.
So, well, V, thank you so much for coming on. I really appreciate it.
Yeah.
We'll stay in contact as we have been doing. So thank you so much, and you enjoy the rest of your day.
Yeah. Yeah. Thank you.
All right.
Thank you. Thank you for having me. Yeah.
Yes.
Bye bye.
Bye-bye.
Yeah.